I'm going to be demonstrating a hip mobilization. It is actually a caudal glide hip mobilization that assists with patients who have hip pain. One of the benefits of this is that it also actually assists patients that have osteoarthritis of the knee. There are 5 different clinical predictor rules that if a patient has these, at least one of these clinical predictor rules, then they have a 92% success rate in this caudal glide. Well, actually, it's a series of 3 different glides, and this is the first in that series. If they have at least 2 of these clinical predictor rules, which you see stated right here on my YouTube, then they'll have a 97% success rate. So what I have is my patient at the end of the table. I have one leg stabilized, and I am actually in mobilization belt and having the belt at the really close up towards her groin. And I'm holding her leg in at least 90 degrees of flexion in the knee and 90 degrees of flexion. And what I'm going to do is kind of feel, depending on where her restrictions are, I could put her in a little more internal rotation, external rotation, increased hip flexion or decreased hip flexion. So finding out where those restrictions are, then I would draw back with the belt, me leaning back, and stabilizing on this opposite side and pulling to the end range. Now what I want to do is do a grade 4 mobilization, so I would draw into the joint and then do a fast oscillation. And I would do this for 30 seconds. Are you feeling that distraction? Deeper. There we go. And so we would do 3 sets of 30. And then give her a minute's rest. 30. Okay, 30 seconds rest. Thank you. And then start again, allowing not only the patient to rest, but also me to rest as well. And then after this series of exercise, or this series of mobilizations at home, I would actually have her do 2 sets of 30 pain-free active hip flexion in supine. And I would have her do that twice a day for a home exercise program. So this is the caudal glide for knee osteoarthritis and hip pain.